I have a paper towel with me to place my supplies. My supplies are a medication vial, practice pad, gloves. I'll refer to these as my alcohol swabs, gauze pad, and a tuberculin syringe, 1 ml, 25 gauge, 5/8" needle. I'll begin by verifying the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. I'll review the medication order in the MAR. The order reads, tuberculin skin test, 0.1 ml, intradermal, times 1 dose. The medication I have available on hand is tuberculin purified protein derivative, 5 tuberculin units, or TU, per 0.1 ml per dose. The 5 TU per 0.1 ml matches the medication dose order for 0.1 ml, calculating and confirming that I will administer 0.1 ml of 1 dose for tuberculin purified protein derivative. I'll gather my supplies and head into the patient's room. Upon entering the room, I'll close the door to ensure patient privacy, place my supplies on a clean, dry, flat surface area, and introduce myself. Hello, Mr. Smith. My name is Bessie. I'll be your nurse. Can I see your wristband? Thank you. Please tell me your first and last name and date of birth. Thank you. All right, Mr. Smith, do you have any known allergies such as certain foods, medications, seasonal, anything like that? No? Okay. Well, Mr. Smith, your provider has ordered you a tuberculin skin test, 0.1 ml intradermally, also known as a TB test or PPD test. I'll review its action, uses, common side effects, and adverse effects. Now, adverse effects require immediate attention, and if you experience any of these symptoms, please report them immediately, okay? All right, the TB test measures the delayed hypersensitive reaction to the purified protein derivative. It's used to detect if you are positive for tuberculosis, are at risk for contracting tuberculosis, and detect latent tuberculosis infection. It is a small amount is injected intradermally, usually on the forearm, and it is examined within 48 to 72 hours. Common side effects are itching, swelling, or mild pain at the injection site. Please do not scratch or rub the injection site, as it will or it can further irritate it and may affect the results. Adverse effects could be fever, hives, or difficulty breathing. If you experience any of those symptoms, please report them immediately. And just so you're aware, you might feel a slight stinging or burning sensation when I administer the medication. Do you have any questions? No? Okay. I'll now perform hand hygiene and apply clean gloves. Select the correct syringe and needle size, 25 gauge, 5/8" needle, 1 ml syringe. Discard this. Now I'll wipe the top of the vial with an alcohol swab. Discard this, allow that to dry. With my syringe pointing up and the cap still on, I'll withdraw 0.1 ml of air. Now I'll remove the cap. Insert the air into the vial. Invert the vial and withdraw 0.1 ml of the medication. With the needle still in the syringe, if I notice any air bubbles, I'll tap the syringe to move the bubbles to the top and slightly push the plunger. Making sure to keep the exact measurement of medication in the syringe. For the purpose of this video, because I will be placing the syringe down, I'm going to recap the needle using the one-handed scoop method. The medication order dose was for 0.1 ml. The medication dose available was 5 TU per 0.1 ml. Calculating the dose to 0.1 ml. I have in the syringe 0.1 ml. See if I can get a good angle on it without glare. I think that's pretty good. Place this aside. Now I'll locate a site measuring 3 to 4 finger length width apart below the antecubital space and at least 1 hand width above the wrist, leaving this section available. If the forearm was not available, I would inspect the upper back. This is my location. I'll assess the skin for any lesions or discoloration and palpate for tenderness. If anything was noted, I would select a different site. There are no signs of contraindication, so this site is appropriate for use. I'll clean the site with an alcohol swab by placing it on the center of the site and rotating it outward. In a clockwise rotation for about 2 inches. Oh, I'm sorry, for a circular rotation for about 2 inches. Discard this. Allow the site to dry completely on its own. I will not blow on it. I will not wave it dry. I will not touch the site once cleaned. With my dominant hand, I'll hold the syringe with my thumb and forefinger. Remove the cap. The bevel is pointing up. With my non-dominant hand, I'll pull the skin from, I'll pull the skin above the, I'll pull the skin tight above the site with my thumb. I'll insert the needle slowly for between 5 to 15, at a 5 to 15 degree angle. Resistance is met. I'll now advance the needle through the epidermis about 3 millimeters depth. I see the bulge from the tip of the needle below the skin. I'll slowly inject the medication. Resistance was felt. I see a blip, approximately 6 to 10 millimeters, resembling a mosquito bite on the skin surface. I'll remove the needle, apply gently a piece of gauze over the site, making sure not to rub the site or apply any direct hard pressure. I would inspect the site to look for any signs of bleeding and bandage the site if needed. The site is not bleeding, no bandage is needed. I'll dispose of the needle and syringe in a sharps container. Dispose of this. I'll now remove my gloves. Both of these. Perform hand hygiene. And document the procedure. Done.